Alcohol. Alcohol is a legal substance that many adults drink for fun or to relax. It can make people feel more at ease and lower their inhibitions. But drinking too much alcohol can be harmful to your health. It can damage your liver, hurt your heart, and increase your chances of getting some types of cancer. Drinking a lot over time can also lead to addiction and make it hard to think clearly. Marijuana. Marijuana, or cannabis, is a drug derived from the cannabis plant. It contains THC, a chemical that alters perception and mood. People use marijuana recreationally to feel relaxed, euphoric, or creative. Others use it for its medical purposes such as pain relief, nausea reduction, or appetite stimulation. Common short-term effects include relaxations, sleepiness, impaired focus and memory, and increased appetite. However, regular use can lead to addiction, respiratory issues, and cognitive impairment, especially in developing brains. Marijuana remains illegal in many countries, and owning it can carry serious legal consequences. Cocaine. Cocaine is an illegal drug that comes from the coca plant. It is a stimulant, which means it can make you feel energetic and alert for a short time. However, these effects don't last long, and people who use cocaine often feel tired and sad afterwards. Cocaine is also very addictive and can cause serious health problems like heart attacks, strokes, and seizures. It can also damage your nose if you snort it, and can lead to mental health issues like anxiety or paranoia. DMT. DMT is a powerful psychedelic compound found naturally in various plants and animals, and can also be produced synthetically. It is known for producing brief but intense visual and auditory hallucinations, often described as a breakthrough experience. DMT is usually smoked or vaporized, and its effects can last up to 30 minutes. Some users report profound spiritual experiences, encounters with otherworldly entities, and a sense of interconnectedness with the universe. However, DMT can also cause negative experiences, such as intense fear, paranoia, and disorientation. Additionally, the long-term effects of DMT are not well understood, and may interact dangerously with certain medications or pre-existing health conditions. Heroin. Heroin is a highly addictive, illegal drug made from morphine. It can be injected, smoked, or snorted, and quickly enters the brain, causing a surge of pleasure and relaxation. However, the effects are short-lived, and users often experience a crash afterwards that lead to intense cravings. Regular heroin use can cause serious health problems, including collapsed veins, infections, and liver or kidney disease. Overdosing on heroin can also cause slow and shallow breathing, coma, or death. Methamphetamine. Methamphetamine, or meth, is a powerful and highly addictive stimulant drug. It can be smoked, injected, or snorted, or taken orally, and can cause an intense rush of energy, alertness, and euphoria. However, the effects are short-lived, and users often experience a severe crash that leads to depression and also intense cravings. Long-term meth use can cause serious health problems, including tooth decay, skin sores, weight loss, and memory loss. Additionally, it can cause psychotic behavior, paranoia, and aggression. MDMA. MDMA, commonly known as ecstasy or Molly, is a synthetic drug that alters mood and perception. It is often taken orally as a pill or capsule and causes an increased sense of well-being, emotional warmth, and empathy towards others. However, MDMA can also cause negative effects such as anxiety, paranoia, and confusion. It can also cause dehydration, overheating, and increased heart rate and blood pressure. Long-term MDMA use can lead to depression, memory problems, and sleep disorders. LSD. LSD, also known as acid, is a powerful hallucinogenic drug that alters perception, mood, and consciousness. It is usually taken orally as a liquid or on small pieces of paper. The effects of LSD can be unpredictable and can last for several hours. Users may experience vivid hallucinations, distorted sense of time and space, and intense emotions. However, LSD can also cause negative effects such as anxiety, paranoia, and confusion. And in some cases, LSD can trigger underlying mental health problems, or in the worst cases, can cause long-lasting psychological effects. Magic mushrooms. Magic mushrooms contain psilocybin, and it is a naturally occurring psychedelic substance. When consumed, psilocybin can cause change in perception, mood, and consciousness. Users may experience vivid hallucinations, altered sense of time, and intense emotions. Some people report feelings of euphoria, connection to nature, and spiritual experience. However, psilocybin can also cause negative effects such again as paranoia, anxiety, and confusions. The effects of psilocybin can be unpredictable and can last for several hours. Ketamine. Ketamine is a dissociative drug that is used medically for pain relief and sedation. However, it is also used illegally as a recreational drug. When taken in high doses, ketamine can cause users to feel detached from their body and surroundings, often referred to as a K-hole. Users may experience hallucinations, altered sense of time and space, and impaired motor functions. Ketamine can be dangerous, especially when mixed with other substances or when taken in high doses. It can cause confusion, agitation, and respiratory depression. Long-term ketamine use can lead to bladder and kidney problems. Nicotin. Nicotin is a highly addictive stimulant found in tobacco products such as cigarettes, e-cigarettes, and cigars. When consumed, nicotine quickly enters the bloodstream and reaches the brain, causing a release of dopamine and other neurotransmitters that lead you to feeling good. However, these effects are very short-lived and users often experience cravings for more nicotine. Long-term nicotine can cause serious health problems, including lung cancer, heart disease, and respiratory issues. Synthetic cannabinoids. Synthetic cannabinoids, often referred to as K2 or spice, are man-made chemicals that are designed to mimic the effects of THC, the main psychoactive substance in marijuana, while at the same time they try to dodge the law as a specific chemical combination isn't illegal. However, because of this, effects can also be unpredictable and way more potent. In short term, users may experience elevated mood, relaxation, and altered perception, but also negative side effects such as anxiety, paranoia, and even psychosis. Also, these synthetic cannabinoids can be very addictive and can cause severe withdrawal. Opioids. Opioids are a class of drugs that include prescription painkillers such as oxycodone, hydrocodone, and fentanyl, as well as illegal drugs like heroin. While it has several medical use cases, opioids are highly addictive, and long-term use can lead to tolerance, dependence, and severe withdrawal of symptoms, and the risk of overdosing. Benzodiazepines. Benzodiazepines, such as Xanax or Valium, are prescription medications used to treat anxiety, panic disorders, and insomnia. They work by enhancing the effects of GABA, a neurotransmitter that reduces brain activity, leading to feelings of calm and relaxations. While benzodiazepines can be effective when used as prescribed, they also have a high potential for abuse and addiction. Long-term use can lead to tolerance, dependence, and withdrawal symptoms when discontinued abruptly. Adderall. Adderall is a prescription medication used to treat ADHD. It contains a combination of amphetamine and dextroamphetamine, which work by increasing the availability of dopamine and norepinephrine in the brain. This leads to improved focus, concentration, and alertness. However, Adderall also has a high potential for abuse, especially among college students and professionals seeking to enhance their productivity. PCP. PCP is a synthetic dissociative drug that was originally developed as an anesthetic but is now used illegally for its mind-altering effects. It can be smoked, snorted, or orally ingested and produces feelings of detachment from reality, distorted perceptions, and a sense of invulnerability. The problem is that the effects of PCP are unpredictable and can vary greatly depending on the dose, the individual, and setting. High doses of PCP can cause severe agitation, psychosis, and even life-threatening seizures or coma. That's also the reason why it's called a zombie drug. Long-term use of PCP is associated with memory loss, speech difficulties, depression, and social isolation.